Now, federal health leaders are calling racism a serious threat to the public's health. Officials with the Centers for Disease Control and Prevention say discrimination has had a profound and negative impact on communities of color, preventing them from achieving optimal health. The CDC lists what it calls social determinants of health, saying those conditions are key drivers of health inequities, and that includes things like housing, education, wealth, and employment. This morning, we're highlighting a UT graduate from the class of 2024 working to make a difference in the medical field.
Every step through this building
I've got one more classroom in here
brings back memories
that I regularly attended.
for DeShala McDuffie.
If you told me that I'd be in the places that I am in my life right now 4 years ago, I would have told you were crazy, because it just doesn't feel, it sometimes doesn't feel real.
A first-generation college graduate, McDuffie paved the way in many ways. Through UT's College Scholars Program, she combined her interests in public health, sociology, psychology, and Africana studies to create her own major, focusing on racial disparities in public health.
Preventative health care really isn't very at the top tier like priorities in my community, and so I think that's a very common practice amongst people that I grew up with. These are my parents, my mom, my dad.
It's an issue she says affects many communities of color, mistrust in the healthcare system. It's something she has struggled with herself.
Health issues and doctors and appointments and all of it's been surrounded my entire life, and so I've been surrounded by the healthcare system, but honestly I was kind of scared of it. It was kind of a fearful thing to me.
The National Institute of Health says medical mistrust may be rooted in patients' past experience of discrimination. McDuffie wants to change that, working toward her future as a physician everyone can trust.
I was able to get over that fear, really see the joy and the love that the healthcare system has. I just want to serve as a support system for other people who have that same fear.
How beautiful is her cap, too? She did that herself. DeShala will be moving to Nashville in July to work as a registered behavioral technician, working with kids with autism, and she plans to enter medical school in the fall of next year.
Good for her. I love how she saw the need. She created her own major to do it. Good for her.
Yeah, she's paving her way for sure.
We're